Hello, I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us for this important live Facebook discussion. Well, over the years, we've seen an alarming trend take shape among adolescents, and suicide rates on the rise. In fact, it is the second leading cause of death among the teen population. Hartford Hospital's Institute of Living will be addressing this very topic coming up on September 15th on World Suicide Prevention Day. And joining me is Dr. Hank Schwartz. He is the psychiatrist-in-chief at the Institute of Living at Hartford Hospital. Always a pleasure.
Pleasure to be here.
I want to first start out by this special event. We have World Suicide Prevention Week coming up. The day is September 15th. We have lots of events happening here at the Institute of Living at Hartford Hospital, as well as a flag raising and lowering ceremony. Let's start with the event that's happening that day, because this really addresses prevention and intervention.
Well, we've got a half-day conference. Our guest is Dr. Jennifer Hughes, who's an authority on some of the latest research about how to detect the risk for and prevent suicide in young people. We're going to hear about some of the latest techniques, most of which focus on cognitive behavioral therapy. They involving the school and involving parents. We're focused on that because the risk of suicide in adolescence is just so high. Mm-hmm.
It is, and it's alarming because we see the numbers continue to rise.
Yes.
And I've seen a report that the numbers among adolescent females are higher than males. Is that true?
The numbers for suicide attempts are higher in females. Actual completed suicides, death by suicide, is higher in males.
Mm-hmm. Let's get into the weeds a little bit. Let's sort of explore suicide as a whole and what we're seeing in terms of the societal impact on that, and the methods and social media. There's such a difference nowadays, and I think there's so many factors that lead into suicide among the teen population. Let's start with social media. This is big because we're seeing kids are on social media. They're not talking. They're not communicating. Let's talk about social media.
It is a really big issue. So social media is one of the primary vehicles for cyberbullying. We know that cyberbullying has been on the rise, and it has terrible impacts. There are any number of suicides that can be traced, directly to it. There's the internet, information that's available on the internet about terrible things that are happening in the world, but specifically with regard to suicide, there are people who are on the internet encouraging others to engage in suicidal acts. But the total amount of time that kids spend either in social media or in other electronic forms of communication is thought to be a contributing factor itself, because kids are engaging electronically and not engaging in face-to-face social interaction. We've had kids who've come in and we know that they're spending their time engaging with their friends and buddies side by side, not looking at each other, connecting to each other, by text. And we think that that kind of diminution of the importance of face-to-face contact actually plays a role in the increasing social isolation, in the kind of de-skilling social skill, the de-skilling of social skills that contribute to a sense of well-being. Those social skills, and when you lose them, contribute to a sense of social isolation.
And so while they're communicating to their friends, they're not communicating because it's through a mobile device or an electronic device, and you're missing that emotion. So if they make a statement that maybe in person you could think, well, there might be an issue here, but if you're making it on Facebook or on Instagram, you lose that emotional connection, so you're not going to know, and that's dangerous.
That's very dangerous. It's almost taking an entire element of the communication process out. Yeah. And the more you take that out, the more you become de-skilled in social interaction, so that even when you are face-to-face, you may have less capacity to really recognize emotion in another than you would have had otherwise.
How do we get past that as a society, in the school system, from parents? How do we get past that? How do we teach kids to communicate and not through electronic devices? I would think that's an uphill
well, I think it is.
challenge.
I think it is an uphill challenge, as any parent knows who's tried to take the iPad away or take the phone away. But there are ways to do it. Families, it may seem like an old cliche about families eating together, not on their social devices, a certain amount of time during the day devoted to person-to-person, family-to-person communication without the use of devices. Schools that keep devices out, for instance. There are ways to teach social engagement, and for those who really don't have those skills, there are social emotional learning techniques that many schools engage in that teach pro-social behaviors and teach engagement and teach sensitivity to one another.
How do we, in terms of breaking through that barrier of that sort of social isolation and being on electronic devices, what should you be looking for? What should parents be looking for? What should teachers be looking for? Signs that somebody might be suicidal, but they're constantly on their electronic device, so you may not get that emotion.
Sure. Well, the majority of people who are suicidal are depressed. There's no question about that. And so the basic signs of depression that, yes, may be more difficult to see when somebody's on a device or not, but they're kind of universal. I mean, people who are appearing sad and isolated and defeated, who may express hopelessness or worthlessness and becoming much less engaged in the world, losing their appetite, sleeping poorly. These are all signs of depression that may go along with suicide. But then, specifically, people who are online looking for information about suicide, people who perhaps are texting to their friends and saying goodbye, people who are looking to give their possessions away. And one very interesting sign, for people who have been depressed or disturbed, for some time, anxious, to suddenly become calm and relaxed may indicate that they've made a decision to attempt suicide. So that's a sign that you want to be very attuned to.
And if you are in tune to that and you notice it, you recognize it, it's important to confront that person, right?
Absolutely.
To engage. And I think that's one of the things that frustrates you, right?
Yes.
Is that people don't often do that.
When I think about preventing suicide, particularly parents, school personnel, I think first, learn the signs and symptoms of depression. Second, if you're concerned about somebody who are suicidal and who are worried about their own suicidality or ambivalent about it, when asked, will reflect that they were relieved that somebody reached out.
Isn't it almost a cry for help?
Often it is.
Yeah.
Often it is a cry for help. Many people who have suicidal ideas and maybe even act suicidally don't necessarily intend to actually kill themselves, but may be ambivalent, may be looking for help, maybe testing the idea out. There's often a period where an intervention by somebody who cares makes all the difference.
Absolutely, absolutely. We are talking to Dr. Hank Schwartz. He, of course, is the psychiatrist-in-chief here at the Institute of Living at Hartford Hospital. A very important topic, suicide among the teen population. And speaking of that, I want to talk about 13 Reasons Why. This is a show that was based on a fictional character who committed suicide at the end of the series. This generated a lot of controversy on both sides of the spectrum. You had supporters saying, you know what, hey, this was the first public discussion of suicide, something that we needed. And then you have critics that says, well, wait a minute, now we're bringing this to the forefront, and this is glorifying suicide.
Yes.
Where do you stand on the issue?
Well, I actually see both sides of the issue. I stand kind of in the middle. I think, and in fact, I think its impact for some has been to glorify suicide and increase the risk. For others, it may have had a preventive effect. In general, for kids who are younger, who are less mature developmentally, I think there may have been a glorifying effect. The young woman who commits suicide is a very, very attractive woman who many, may emulate. But at the same time, her suicide was a vengeful suicide, blaming those around her for what she has done, which is a kind of developmentally young way to think about suicide. If I kill myself, it will hurt them, they'll be sorry, I will have my revenge. And so we see more young people coming into hospital emergency rooms who've been thinking about suicide or actually attempted suicide, who cite having seen this program. At the same time, there are other, perhaps somewhat more mature kids who may have been thinking about suicide, who see the horror, the nightmare of this suicide, and it is presented in a horrific way, and its impact on the people, particularly the parents of the dead young woman, is horrific. And some of these kids are saying, I saw what suicide could do to my family and to my community, and I can't do that.
Right. I thought it was interesting. There was a study in JAMA that was released right after 13 Reasons Why, and they looked at searches after, I think it was after a few episodes, 19 weeks after it aired, and they were looking at searches, and kids were searching how to prevent suicide hotline, which was good. But then on the other side, kids were searching, how do I kill myself?
Yes.
How do I commit suicide? So again, there's that really fine line there.
Absolutely, and that gets back to the risk of the kinds of things that are on the internet. Because if you want to learn about every way that you can kill yourself, and if you want to connect to people for whom suicide is acceptable and who will support your thinking, in this way, and maybe even encourage it, it is very easy to do. So the internet has created an exacerbating threat or risk to young people this way.
Let's talk about suicide. And when folks commit suicide, there's the impulsive, and then there's the really well thought out plans to suicide.
Yeah. So there are many people who become depressed. They go through phases. They may at first just think, well, I don't really want to be alive, but I'm not going to kill myself. But that may move forward in time as they feel worse to maybe thinking about how to actually do it, to planning how to do it, maybe to rehearsing it. These are the people who think and plan methodically, and that may lead to an actual suicide attempt. There are others who feel depressed, maybe a little bit suicidal, but they're kind of ambivalent about it, but at just the wrong moment, a disappointment, a shock of some kind, a loss, may lead them impulsively to do something, to jump, to shoot, to take an overdose. These folks are particularly risky because with the person who's planning it and thinking about it, if they're in treatment or if they're engaged with their family, there may be ways to detect this and to intervene. A person who impulsively attempts may really circumvent that entirely. And so, nobody knows that it's going on, and suddenly, impulsively, it happens. There are some things that you can do, though, for the impulsively suicidal. Keep guns out of the house, for instance.
Right, the access. To someone who is impulsive about it, is there anything that can be done to save that person? Because it's a fleeting moment. It comes so quickly. Are they determined? Is it something that you really can try to prevent or try to stop them? Whereas somebody who's methodically thinking about it, you can try to. But somebody who's impulsive is so dangerous.
It's very hard. So there are some public health approaches. Again, campaigns to keep guns, if they're in the house, locked carefully. There are some notorious bridges around the country, and communities have put nets around these bridges because they are the sites where people often may impulsively jump. But the single most important thing is getting treatment. Identifying, long before somebody is suicidal, identifying that they are depressed, distressed, anxious, and getting treatment. And
you know, we've heard stories of victims of suicide, because they are victims of suicide, and we've heard survivors. There's one gentleman who jumped off the Golden Gate Bridge, and as he was going down, he thought to himself, what am I doing? I can't do this to my family. And it's, you know, you just want to say this is one fleeting moment that will pass. And he survived, and it worked out. But it's just, if you could just get through to that person that it's just one fleeting moment, it'll pass, and you'll be fine again.
Yes. Right? Well, again, for the impulsive person, that, you know, it may be too late, but what that person was demonstrating in that fleeting moment was a resiliency or protective factor misplaced by a few seconds.
Right.
The protective factor being, I'm engaged with my family, I care about them, I don't want to do this, you know, to them. And the best thing that you can do, again, is be engaged with the people around you. Be particularly engaged with the people that you're concerned about. Touch on those protective factors. A protective factor, love of family. A protective factor can be love of a pet sometimes.
Right.
A protective factor can be a religious belief that to kill yourself is a sin. Whatever it is, to work with those protective factors with somebody and try to enhance their resilience in the face of stress that might produce that impulsive moment.
Be connected and ask questions. Don't be afraid to ask those questions.
That's right. That's the trick.
Dr. Hank Schwartz, thank you so much for spending some time with us. We always appreciate that.
Thank you.
And we do invite you to take part in that special event that we have coming up here at the Institute of Living at Hartford Hospital on September 15th. We have that flag lowering ceremony at 10:30 in the morning, followed by the guest speaker that will be happening. It'll be going on from 8:30 to 12:30. You do need to register. There's a number on your screen, 1-855-HHC here to register. Don't miss that important event for World Suicide Prevention Day. I'm Hartford Healthcare's Tina Verona. Thank you so much for watching.